So the Australian Medical Council now recognises that medical schools need to be producing doctors or helping people to be trained in a way that recognises that we're now in a rapidly changing environment, and that's changing people's health and also changing pressures on healthcare. And so this is the definition that they now use in the accreditation documents for medical programs. This is actually a definition taken from a very famous publication by the Lancet called the Lancet Commission on Planetary Health, which was published in 2015. But planetary health is actually quite a simple concept. It recognises that our health of humans, is inextricably linked to the quality and the health of the environment in which we live. And you'll hear that shortened down to healthy people, healthy planet. So it's not only important that we care for ourselves, but in order to care for ourselves, we have to kind of care for the quality of our environment and the planet.
They also introduced a broader sense of sustainability than they've previously used in the past. Up until now, people have really only been focused on financial sustainability, but now the AMC is emphasising the need to use the Brundtland Commission definition, which has that triple bottom line, also emphasising that there is a social cost to decisions and also a environmental cost to decisions that we make. And so that's one of the things that we need to encourage you to be thinking about as you go through. It also gets us to think about the concept of future generations, how we have to be thinking beyond our own immediate needs, that we can't be exploiting resources such that there is nothing left for future generations to be able to meet their needs. So the Australian government, the Department of Health, actually uses future generations in their byline. So there's a general acceptance that it's not appropriate to be kind of just using everything up for the now with no consideration for the future. So those two important concepts.
Okay, so why are we here in Katoomba having a discussion around climate change and planetary health? Well, you've just travelled through the western suburbs of Sydney, through here to Katoomba and on to Lithgow, because you've all had a day in Lithgow. And these are communities which have been repeatedly hammered by compounding climate change induced natural disasters. Who has never been to the Blue Mountains before? I'm conscious that we have people from not only... Okay, so once again, this is a typical group. So where are you from?
Adelaide.
Adelaide, good. And you?
Melbourne.
Melbourne. Any internationals here as well? And you're from?
Canada.
Canada. Yeah, we've had lots of Canadians. Yeah. China. Oh, well, welcome to you all. And it's a fabulous, this is a fabulous area, and you know, these World Heritage listed sites are precious. These pictures here to my right and your left are all taken locally. These are all pictures taken locally. They've all been taken since 2019. The picture to the far right is actually taken from the Lithgow Clinical School, and that was at the 2019 bushfires, the 6 months of bushfires that burnt along the east coast of Australia, and devastating. And the next picture beside it is, give me a guess of what that might be.
Fog.
Actually, it's not fog, although you do see a bit of fog up here, but
Pollution.
yeah, it's bushfire smoke, bushfire air pollution. I took that photograph coming into land at Sydney Airport on New Year's Day, so it was actually should have been a bright sunny day, and that's how much particulate matter was in the atmosphere. Big natural experiment over the east coast of Australia. The population has lived in that kind of toxic air pollution for 6 months. So it'll be very interesting to see what the long term, there were short term outcomes, of course. Next picture, guess of that. What's that picture of?
Heat map.
It's a heat map, that's exactly a heat photograph of Penrith. So in the January, so that picture was taken in late December. photograph was taken on New Year's Day. About a week later, that's Penrith, and that's 49. That's what 49 degrees C looks like, particularly when you've got a sea of roofs, most of which are black these days because someone thinks that black roofs look good. Dreadful in hot weather. This one, not a true question. This floods. That's right. Same area. So this is the Nepean floods, and that flooding happened, I think, 3 times in 18 months. At the same time, all that water's around, up here in the Blue Mountains, they had massive landslides in which people were killed. So just repeated climate-related events. So as a result, people are much more aware now of the threat that climate change and extreme weather presents to human health. And so that's one of the reasons why we bring you here to have to do this session. So we're going to talk about human health effects of climate change, and we're going to focus on heat. So the health impacts of heat, we're just going to focus on that. The impact of climate change on healthcare systems. We're going to examine why healthcare, we're part of the problem and we need to adapt and mitigate our own self, and then what can we do about it. The Intergovernmental Panel on Climate Change, the IPCC is what you've heard it often called, is the world's most authoritative scientific body on climate change, and they report every 8 years. The last report came out in 2023. And so those little pithy labels are by the UN Secretary General, basically acknowledging that we're not doing enough and we're certainly not doing it fast enough. So the quote that I want to sort of just bring to your attention is that they say human-induced global warming has spurred changes to the Earth's climate that are unprecedented in recent human history. Climate impacts on people and ecosystems are more widespread and severe than expected, and future risks will escalate rapidly with every fraction of a degree of warming. And it's that last bit, every fraction of a degree of warming, that I just kind of want to pin in your brain, as Peter Carroll would say, because essentially everything that we do as practitioners, we have a capacity to do that with less waste, less pollution and less carbon, and that's the journey we need to take you on in the next 4 years.
This is what that means for Australia, and for all the countries that you guys are from, you can do a similar image like this. So essentially what we have is both national and global temperatures are continuing to rise, and I'll just simply highlight a couple of things. We can expect heat waves will be more frequent, and then we can expect that they'll be more intense. We know that the duration and frequency of fire weather is actually going to be also increase, and that's obviously a global phenomenon. And also when it rains, it's raining much more heavily. So basically we are moving into a space where flash flooding and flooding is also more a risk. There's lots of graphs like this. So this is global average temperature compared to the middle of the 20th century. And so that's what the y-axis is. And then the x-axis is time in 20-year aliquots. So basically what you see here is the trend, the overall temperature trend, which is one of increasing temperature. 2024, last year, was the hottest year on record globally. We have now reached 1.5 degrees of warming, and so that is the first limit we had set ourselves as a sort of civilization, really, to try and halt things to 1.5. We're actually now in the process of passing 1.5, and they had thought that we might not have got to 1.5 until 2030, but we were actually there. So as the IPCC said, it's happening faster and than we had anticipated. The last 10 years have been the hottest 10 years ever recorded. So what's that mean for human health? This is a model. This particular model was developed by Ebby and Haynes. It's published in the New England Journal in 2018. So there is other models out there that you can see. They say very similar things. They just present them in different ways. I find this a very easy way for people to engage quickly. So along the top are the exposure pathways. Some, not all of them, some are the exposure pathways. So extreme weather events, heat stress, air quality, water quality, because flooding actually changes water quality, as does drought. And food supply, so flooding and drought affect food supplies. And vector distribution, so mosquitoes are having a very good time. Dengue is expanding, as is the footprint of some of our own vector-borne diseases, Japanese encephalitis, Murray Valley encephalitis, and then social factors. So if communities don't have enough to eat, then you have social unrest. People are forced to leave, and so you get mass migrations. If it's too hot, people have to leave where they live. So we're creating a lot of social change as well. Interestingly, the first time that heat really came to people's sort of awareness was the 2003 heat wave in Europe. And, it gets hot in Europe. It's a large landmass. It gets hot in summer. But it really hadn't really been a problem to them until about 2003, or they hadn't really been aware, let's put it that way, until 2003. And in August, and that's a piece taken from the paper at one point, that's a heat map of Europe. They're saying there that 3,000 people have died. Well, it was 75,000 people who died in that heat wave in Europe, and that was a complete shock to Europeans. Heat had never been a problem like that for them, and it was people living alone, people who were not being checked, people socially isolated. In response, Europe has actually done a lot to prepare for heat. Last year, the European region of the WHO estimated that 175,000 people a year die during summer in Europe due to heat stress. They are all preventable deaths. So your job when you are qualified and now is to be really aware of the potential health impacts of heat, because you can prevent unnecessary morbidity and mortality if you're aware, okay? The drugs you're going to prescribe are going to make people more heat sensitive. You're going to need to be factoring this in more just for your own family and for yourself as well. So this is a graph from the Lancet Countdown, comes out every November. It reports on 43 indicators globally for the health impacts of climate change. Okay, they produce it in November because what happens in November? They're trying to bring a health voice to what big event that happens every November?
The UN convention in New York?
It's the Conference of the Parties. It is the Conference of the Parties, but it's held in different locations. Might be in Australia next year.
Really?
Yep. This is heat wave exposure in person days in the billions and over time. And what you see here, this is particularly in people older than 65. Okay, and what you see here is heat wave exposure. People over 65 is increasing. Why do you think I've shared that one with you? There's a lot of graphs I could have shown. Why this age group?
Because we have an ageing population in Australia, and we have a lot of people over the age of 65.
And what significance is the fact that, that's true, we are, in lots of communities the same. What's significance though in conjunction with talking about heat stress?
They live alone.
Yeah, well, they're vulnerable, and that's true. Many people do live alone. It's just as you get older, your capacity to thermoregulate declines. Okay, so you're much more physiologically at risk when you're older. Who else is at risk physiologically? Babies, that's right, small children. Babies particularly, they haven't got, their physiology hasn't actually developed. Who else? Doing well?
Menopausal women.
Yeah, I'm not sure about menopausal women. I mean, I know you feel hot, but pregnant women, basically, because when you're pregnant, you're very vasodilated. Anyone else who's vasodilated? Yeah, sick people, people with chronic illness, and also people I've said previously, a lot of medications that we prescribe work, like particularly antihypertensives, work by peripherally dilating you. Okay. That's quite a lot of the population, pregnant, or young, on antihypertensive, 10% of the population. So yeah, there's a lot of people who are actually have diminished thermoregular capacity, and so therefore at risk. And we actually know a lot more now about what the physiology of thermoregulation is, and some of that work's been done at Sydney University. Fantastic guy called Ollie J. Anything that Ollie writes is worth reading. So this is a heat map for Australia. So what I showed you previously was one for globally, but every country has its own. Every country is heating at a slightly different, depending on its size. Australia is a large landmass. We have already reached 1.51, so we're just slightly above the global level. And this is a Bureau of Meteorology. If you watch the ABC weather reports, they often will put up a map like this. This is actually taken in January 2019. In 2013, the Bureau of Meteorology had to introduce new colours because it previously only went to about 44, and then they had to introduce new colours because we were just getting too hot for their colour code. Probably have to go high soon. That was the heat map. You're on a rural intensive. What's that show you about this continent, about Australia?
That rural and regional areas are really hot.
That's right. Rural and regional areas are particularly sensitive to climate impacts. For healthcare, what that means is that it's now too hot to deliver temperature-sensitive care in some areas. That's pretty dramatic, isn't it? You don't think about that. Might just be too hot some days to actually deliver some forms of care safely. This is Catherine, from those folks who are overseas. Centre Alice Springs. Catherine's north of Alice Springs. And one of the fantastic initiatives has been, we, as you will learn, have a lot of chronic kidney disease in Aboriginal people. One of the great innovations has been mobile dialysis, which means that people can be dialysed on country. Can't do it in summer, it's just too hot, it's not safe. So people have to come off country to go to dialysis centres. So it's affecting how we deliver care. There's not so much written about that though, and this is actually the front cover of a research report that the Royal Australasian College of Physicians commissioned. The college went out and commissioned a piece of research because they thought there was a gap in the knowledge. And these are our sister colleges who joined us in that piece of work. The Australian healthcare system, surprisingly, is not ready for extreme weather. It's not prepared for the impacts of climate change. And that this places great stress on the health sector. I mean, we've had, as they have had in other countries, Ballina Hospital had to be evacuated at short notice. The previous flood. It's not an easy thing to do. And also, that puts a lot of stress on you as a worker, on the health workforce as well. And during the fires, a lot of the hospitals in the country were cut off. We're part of the problem. Healthcare contributes in Australia 5.5% of the national carbon account. And this is what makes it up. A large part of it is pharmaceuticals. Pharmaceuticals are very energy dense to prepare. They're high technology pharmaceuticals. And a lot of them are wasted. They're fantastic. We need them. But a lot of it is wasted. And when it's wasted, the way that it is properly got rid of is it's incinerated. So it's a lose-lose wasting pharmaceuticals. And this is in public and private hospitals, and that's where a lot of procedures and things are taking place. No one wants to be here if they don't have to be. You're better off preventing illness, and you're better off, if you're able to, treating people in the community, if possible, where that's feasible to do. On the other side, that's the first international global account, and it's at a global level, it's 4.4% of global emissions is just the health sector. So we need climate resilient and environmentally sustainable health and healthcare, And so this is our new National Health and Climate Strategy, fantastic document. It's only been out for 18 months, but it gives us a pathway to adaptation and mitigation in the health sector at a national level. Previously, up until then, that we haven't been particularly well organised on these issues at a national level. Anyone who's a local will understand that. But in fact, the states here have been getting on with it, and it's one of the values of decentralised sort of government in some regards. So we now have a national strategy, and we are moving into a much more developed adaptation and mitigation inside health, right? This is a really recent, and I really like this. We have some fantastic data. We have fantastic public data collections in this country, and you probably have them in Canada as well. But we have a fabulous Bureau of Meteorology, a fantastic, the CSIRO, the Australian Bureau of Statistics does amazing data collections, and Geoscience Australia. These guys have got their data collections together and are working under this Australian Climate Service and have come up with a heat health risk. So they've combined some information around working out what exposure is, what vulnerability of communities are, and what are some of the things that modify that. So in the modification is actually understanding where you have green infrastructure, cool places, where there is good social connectedness and access to health services. And then you thinking about where you've got outdoor workers and features of the built environment. So you're up in the Kimberley, you've got an outdoor workforce there that, or out on the oil rigs off the coast. So we have some very exposed working groups. And then we've also got sort of housing conditions and socioeconomic status. And so they've brought all that together into this risk. And so this is the map for Sydney. And as I've said to everybody else, this is not the face of a fish with measles. This is here, Sydney, the Sydney Basin. So this is Botany Bay. This is Sydney Harbour. And then this is the Hawkesbury, yeah, in there. So this is Gadigal country. And this red, I'm not suggesting that you would pay any attention to this. Just look at the index itself and just look at the red bits, and you'll see it's the western suburbs that run it, and up here into these suburbs, into the mountains. So that's fantastic. If you're a GP, or you're a health service, or you're a council, and you want to understand where you've got to focus your efforts, it's not on the cool. There will be people at risk here, but it's not the cool coastal areas that are well vegetated on the northern suburbs of Sydney. You know, this tells you exactly where your risk is, puts a number on it. Another thing which you need is you need to be able to give people information about how to keep cool cheaply. People, you know, need to be able to look after themselves for prolonged periods of time at low expense and keep cool. And what happens often in long periods of heat wave? What's one of the things that we lose? We lose electricity. We have blackouts. And so just when it's fine, you know, without a doubt, you know, air conditioning powered by renewables is going to be keeping a lot of people comfortable in the future. But sometimes the power fails. And so it's just having measures that people can have in place. And when you're a doctor, you need to be giving people advice that they can follow. And Ollie J prepared these. I'll send a link out with our things to follow. But this is about mitigation. This is about thinking about how we do things differently, and some of the things that we need to do differently create what they call health co-benefits. So basically, what we're trying to do is things like get people out of cars, encouraging active forms of transport or public transport. By doing so, you drop the pollution that's actually related with particularly combustion engines, because they generate particulate matter and pollution. So there's a health co-benefit that comes from better air quality. Similarly, if we move to renewables, we are burning less fossil fuels, and here in Australia we have burnt coal. If we get away from burning carbon, then we lower our CO2, but also get rid of the particulate matter and improve air quality. I won't go any further into that, but you get the idea that we need mitigation activities. We need to get all our hospital systems that are rapidly moving to be only powered by renewables. So as a healthcare sector, we can take control of some of these things.